Which area do you like living in? Or you want something that is central?
Not far from. I don't want anything far from.
Pretoria.
No, not. Okay, waiting. I don't want to be far from access to highways, access to public transport.
Why highway is out of everything?
Why is it when you have taking access to freeway, like for example, right now you can now move already Kosenchuru.
Yeah.
When I tell people who can now Kosenchuru and like Espana, they're like, so far. And I'm telling you, I beat so many people but now around. Got travel time. My distance seconds. It's 38 kilometers. But on days like this, most non-traffic or anything,
When it's quiet.
I clock home 25 minutes
To get here.
You
see, I can't spend more than 20 minutes going to work. I can't. I will get bored, I will go back. I can't.
What's on the white people they don't want to travel at the
No. Like when I love driving. I enjoy driving. Like I think the next trip that I need to do is to maybe drive to Cape Town, not fly, drive to Cape Town. Yeah, I love driving. That's why I want a car that when you enter the highway,
it goes.
Yeah. But when I'm going to work, no. I mean, even when I was at school, accommodation, because I was staying outside the off-campus accommodation, I used to look for places that are just nearby the school. Somewhere where I'm going to get to work, I'm going to get to school tired. I'm going to go from school to home tired. I don't want that. I've traveled too much. I used to, my high school used to be like 4 kilometers away.
4 kilometers away?
Yeah.
4 kilometers, it's nothing.
Oh, yeah. It's actually, no, it's probably more than that. Maybe 4 or 5. It was a lot. I didn't want that.
Seriously?
In winter. And then now when I come to work, for me to get here, 6, 7, I leave home at 6:15. That's like
including traffic.
Yeah, that's including
traffic. Like this.
On a day like this, I can leave half-past.
Wow.
And then if I leave half-past, the only traffic that I'll get is here.
Yeah.
Parking lot.
Yeah, because that's so good.
Yeah. That's why when we finish school, they're like, people, we're not going to stay Kores, blah, 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 blah. My comserve, I was staying Kores.
Oh, and I'm looking to work.
Bra, lunchtime, you're going to shop up our neighbor.
Now I think right now, this thing might start now because of the petrol. I wonder the way price of petrol is so ridiculous. I think I might start now being conscious of
the
distance. But otherwise, because when I'm off to Akimotozula, I don't like driving, but I don't mind driving to work or from work.
20 minutes. King, what are you listening or what are you doing on the road?
That's your time to reflect and think and go and recap your day. Wait, go tell you one thing. For example, I remember Madam was like, I wonder if we could work, maybe go play A1 and all that. I'm like, and this thing, we should use transport A1. Yes, financially it's a good idea. But in terms of, I feel like when you're going to work and then when you're coming back from work,
that's your time.
It doesn't matter how many minutes or obviously it can't be how many hours, Mara. How many minutes it is long.
And you're right, yes, because I do most of my thinking and I take most of the decisions when I'm driving.
Like you're able to think to monad, you see things like over relaxed. It's a good thing too. You have your own time too. And lately I've developed this habit after knocking off, when I get home, I get feel. I don't care of Mokoloing immediately and run into the house. Get back and open the door, stretch my legs, chill. Maybe I was listening to a radio station, Why do they do have segments, study topics?
Yeah.
Just chill and listen to the whole topic, or maybe just chill, listen to music, get some.
So get to the mood where now I'm home.
Because obviously, you know, immediately after going to Daddy. Like you never have, you don't notice it all. I think that's something we are not really aware of as people. We are living in this so fast-paced life. We forget what we need time for ourselves.
But do you think I would say nurses, because nurses, there are people that work, if you're an engineer, you'd be working with machines. You are there, it's you and that machine that you're assembling. Do you think it is important now for nurses or any any individual that works with people to actually have time just isolated from everyone else, be it their spouses, be it their family, just time to themselves?
100%. And for example, like it was in November. Madam Ampota so December mwana reza jwang. I was like, hey Joe, mwana watsama at December. First 2 weeks at December, we are go maternal grandmother.
Yeah.
The next 2 weeks at December, we are go paternal grandmother. Or I'm going to miss him or whatnot. Born. But
I need to rest.
I need to rest. Because I get it off. Give me taking. I have to wake up at 6, prepare for crash. So I want to technically...
You're still on duty.
Exactly. Like you're not resting. As much as you can say for rest from work. But you're not rest as in totality. You still have your household duties. Yeah, and I met Malova, she went to a wedding in... then we remember was it you? When I told you she went to a wedding in Madam. What was I telling you? And then she was like, what's on Friday? She will come back on Sunday. I was like, hey, Joe.
Hooray.
Hooray.
I'm going to have time to do what I want when I want.
You just chill. You think, even though I'm not planning anything big, but you just want to relax.
And it doesn't mean you don't like her around.
No, that's one thing I think some other people, they don't really understand. As a human being, why do you have the right, maybe let's say, how you're off next week? Book 5 days, only one, wherever. Or just drive, Cape Town. Drive 1 minute to Cape Town. And do you, be you. Remember, at the end of the day, we are individuals, and you are your own person. You can be in love and say, hey, you have been united. The Christians got this thing, you're making Holy Trinity, you are one now. But
you are still, because when you are stressed, you have to be whole and okay with yourselves before you can solve whatever problems that comes into the relationship in this union. It's right, man. And I would take it as when as a person that works casualty, it's, I think, out of all the disciplines, it's very much busy.
It's crazy. It's crazy, Joe. So and then when you get home, happy,
it's another
exhausted. And now you're exhausted. Understand one thing. Regardless of how old is your child or children, they still want your time. And you have to respond to it. It's like when they say go casualty, there's a resource. Or you are tired,
or you are eating.
You need to respond to resource. It's the same thing you go to. Okay, you need to respond to the duties that have. Then you must perform.
Yeah, you can't say what I'm on lunch.
All right, guys, break. So we need to identify such things. Sometimes you just need your own time.
Yeah.
And that's, you remember, we were growing up and people don't understand happen. They see us as men as Gary Michini or hey, a man must do this, a man must do that. They don't understand. I think you do realize lately people are a lot of a topic of mental health.
It's growing up more and more.
Because it's very, very serious too. It's very, and you realize sometimes, you know, when you grow up, there's certain things you went through more life in, of which maybe you didn't deal with them simply, or maybe you are not aware. But as you grow up,
they come back.
And then sometimes they might hit you and be aware, whatever that's going on in your life, it's because of the past or certain things that happened in life in your house. Sometimes things happen more life in your house, but you're not aware. It's a comeback from your past to understand. So like that's where mental health comes in. You need to be
healthy mental imbalances. Damn, man, you know, I never looked at it. Especially for someone like I'm interested on, you're working in a department that is demanding. I mean, physically, you're always on your feet. Emotionally. How did you choose, you know, casuals? Like, out of all the specialists, bro, you could have worked inside. Why casualty out of all the specialties that you've circulated in? Yeah.
No, initially it wasn't. Initially, it was go ICU. ICU, because back home, I used to do overtimes go ICU. I've always had that thing. And I guess I was based go orthopedics, but then I had that thing. I don't want to be stereotyped and only know the orthopedics. And then I started doing orientation, go neuro ICU.
Okay.
And then when I went to Nollen, orthopedics, I had a broader understanding of patient because of the things they taught me. Go neuro. And then I'd go back or get called for the overtime, go neuro. And then now you have a broader understanding or perspective of the patient. Let's say go orthopedics, when you have an emergency, you know, sometimes patient they will pulmonary embolism or whatever, maybe patient that crash. But because of that ICU exposure, I'm able to cope, go orthopedic unit. And then, because you know, honestly speaking, you know, sometimes this thing or general ward, you don't know much. Next time, actually, the thing I don't know much.
Yeah, I find that common, especially like here in this world. It's quite, it becomes routine.
Exactly.
Yeah.
The medication you give tramal panado Clexin. And then I remember this one time they would do the you know, the routine bloods like Madira Isu, your CRP, your ESR, the normal platelets and whatnot. But in terms of the gases, to interpret gases.
Like if you give me an X-ray, I don't know, I think it was one student, they sent me a picture of an X-ray, said, can you please help me interpret this? I was like, you know what, to be honest with you, the last time I saw an X-ray image was in high school, I was in varsity. I don't remember, because we don't do those things here.
Nothing. And go orthopedic, when you get an X-ray, fracture. Lack of femur fracture, because they will do more total hip replacement. You see maybe the prosthesis, like your simple basic things. You understand? You will see the pneumo, the hemo, it's a complicated, like the pneumoperitoneum or whatever. There are a lot of things.
Yeah.
So okay, request a vet, keep up for ICU, go metron. My metron was like, the only ICU you can go to, because you are within surgical block, trauma ICU. I was like, oh, it's fine, I go trauma ICU. And then when I had to go to trauma ICU, they were like, hey Joe, you can't go to trauma ICU. Trauma casualty, mind you, that time I don't even have an idea
what's happening.
Because at the time, student, I never went to casualty.
Any casualty or this casualty?
Only went to.
Konji, where did you study?
In Latsky.
And
I was
based Mojobek Jain.
But I've never been going to here. I've went to Pete Casualty. But I didn't have an understanding of what am I doing here, what's going on, because I was a student and I didn't have a clear picture of what's going on. Even though when at the time when I was in orthopedics, I would admit some patients from casualty, but still I didn't understand
how do they get here?
Exactly.
What is it that I need to do here?
When they say casualty, what casualty entails. So eventually, Mitron was like, go casualty, Ukaya, and then I was like, well, now I'm not that afraid to start
the new environment.
In a new environment, you understand? I was like, sharp, and then I had this guy, Idladla is leading to get training level go college. They will already go casualty.
Yeah, so to adapt was quite.
Much that they go casualty. They will show me the way around, and then when I got there, it was completely different. No routine, no tramal and panado.
No, yeah. Doctors rounds.
Doctors rounds detail, but it's not your
normal
doctors rounds go what you understand.
Yeah.
Like the relationship, the working relationship there, so it was you.
Now this when you're going to casualty, it's how many years
after orthopedics? Or after training?
After training.
It's 3 years after training.
Wait, so when did you finish your when did you do your concept?
Concept was 2015.
2015. I want you to take me on your 4th year, 2014, last year of college, into the transitioning to concept. Right. What was happening on your 4th year? Emotionally, were you ready? Were you ready to say I'm gonna join the workforce? Were you ready to say now? Yeah, I was saying about a full-time employee. I'm not gonna be faced with books. I'm not gonna be faced with assignments. It's just gonna be me serving the oath.
I remember for now 4th year was not a preparation for concept or for actual workplace. Okay, like now, next year I'm going to be a full-time employee, a registered nurse with so many responsibilities, blah blah. 4th year for me. Because honestly speaking, 4th year was just fun.
Dude, people in 4th year are worried what I'm gonna start.
No, I was not. I'd say my 4th year for now it was recapping my college my college days. I was recapping college. Like I was closing. Because we had fun. Sterfontein.
Dude, you went to Sterfontein?
Yeah.
You lied.
The whole 30 days.
We only went to Tara.
Tara, yeah. Remember, Vets and I think in UJ. You only go to Tara. Yeah.
How was that? You know, I've never been to Sterfontein even today.
Is it?
I've never been there. The stories that I get there, they sound. I don't believe them. It's like they say it's like a jail.
It's not. It's not. It's just a different environment. And the problem with Sterfontein, it's secluded almost in all spheres. That is why I think people say it feels like jail. But in terms of working, when you get there, and the nursing or the patient management, it's completely or sort of different because you're dealing with psych. It's not.
And you went to Sterfontein on your 4th year?
4th year.
So 4th year, it's Sterkis.
4th year for us, it was Sterkis, it was Tara, it was psych clinic, and then it was community clinic.
Management, you did it go 3rd year?
3rd year.
Yeah.
3rd year. It was 3rd year.
You know the kids that are doing this regulation I think it's 174 that are doing now. I don't think they're gonna experience such things, man.
Are they not? But training is going to be completely different from now on.
Sure.
Now that's one thing I also say, that as much as we students from Endlatsky or Bara come out with a diploma, but I feel like even though it's not a degree, I feel like we were also fortunate because of the exposure.
Yeah, college students, they spend most of the time in clinical. That's why I remember when I think I was doing my 2nd year, with this other nurse in Ward 11, in Helen Joseph, she said, when it comes to practical, leaves and ask students alone. But I was doing my second year. We were taught by some first years on how to dress wounds.
That's true.
I'm like, wow.
I can tell you, ka first year yaka. Rona ko college. After writing your exams, they tell you, you need to start practicing for the next year. So, first year, first year it was absolutely basic necessity.
Yeah.
So, second year we were getting introduced into pharmacology.
Yeah.
So they said to us, expose yourself to medication. No medication trolley. All these 5 rules tell you now there are 9.
Yeah.
The
right medication, right time, right route.
By November, we were pushing through EN. And then I remember this one time there were 10-year students from VETS because now I was based more much of the I was more clued up than the 3rd year.
In the time you're doing first year, bro.
In the time now I'm finishing first year, or I've finished first year. I was awaiting the results. That's when I saw Hore. And then even years after that, I realized Hore, we are taking students from college when it comes to practical.
Sure.
But when you put motor vets here, they will tell you physiology, the book.
Yeah, the theory, they are filled with theory. They write a cardex, 4 pages cardex.
And the worst part, not to tell you the truth. And that's key, I don't know about now, but and that's key students, we were good, ne? But para students, yes. Para students.
When it comes to
practically theory. Because again, para falls under VETS.
Yeah.
So they are taking their moderators and their tests. They come from VETS. They are set for VETS, and then the moderators, like they are most of the.
So they are both balanced in theory and practical. Yeah.
But when it comes to practical, Joe, yes. There was a time kile based ko clinic 3rd year. I was with para students. Natural when I had to do whatever that I had to do, go clinic, I'll wait for a lecture or the facilitators.
Yeah.
And then, I'll have to wait for one of the nurses or span under clinic so that I can work under supervision. They will take chronic, Bali 2 this side, they do chronic, and then because they come from 2 class IMCI, 2 idira I think study prevention.
Yeah.
Hey,
they are pushing it.
11 back.
And then they are done. And these are people in your level.
Same year.
Sure.
We are all doing that year. Marabona just they are from Param. Naki problem guys liaka naki ne krato raka kilo raka makunyi ona they are leaving but say acha makunyi atina say haya
and they just span
what's the span that done
managers when they come back they don't complain
next they would know who to job and para students and then they will come in numbers so maybe like 10 of them and then by divide 5 it like that main building barraking the chronic and yada and then maybe 3 go that section area pits get IMCI the king whatever
yeah.
And then they would hardly go side like ANC because ANC you'd have to do or you'd have to be under midwifery so that you go to ANC but when they were there for community so but I did IMCI and then there was room in the Kokoning family planning. I'm not about that way. Done. But 4th year for natural, 4th year it was not a preparation for.
It was just recapping.
Yeah, I was just
because now I'm putting a full stop. You enjoyed your undergrad, ne? Yeah. You know, I meet a lot of 4th years in my endeavors and my students most of the time, and the biggest worry is that if they don't feel prepared, like they are worried. Or, yeah, I'm gonna kill someone. I'm gonna be now a shift leader. I'm gonna be responsible for so many lives. What if I do mistakes? What if I don't do that? What if when you never had any of that, any of those worries? Why is it? Because you knew there's always gonna be nurses that are gonna be with you, or you just had confidence in the knowledge?
I don't understand. How did I? Or what was my thinking back then? I can't remember. I won't tell you. But one thing I remember, I never had that thing. I'm a responsible individual. Like, it doesn't matter, Kiko guy. But I never had that worry. Yo, Gonesa, I'm going to be a shift leader. Or I just saw myself for the year. We were divided into two. We were two groups after the exams. We were forced, there must be a first group, it's a young leave November and work December before ComServe. And then there was a group, it will be November and take leave December. Now I was in a group leave November and I worked December. So when I worked December, I was based on then go orthopedics 374. And then ComServe, when we were doing placement, I we did that orientation week. Yeah. Was it a week or 2 weeks? Or
yeah, it's like a week.
I think for me it pushed, right? I think it was like 2 weeks.
Orientation,
yeah. When we got here, even though I knew the hospital, but they still gave us that orientation at 2 weeks. And then when Hathikin placement came, they said, you're going to 374. Remember, I don't know, Kalona, we were given options.
Yeah,
to write down which units. And then we wrote down the units before we had again. We came actually to orientation. We wrote December because we got the placement letters after the exams. So we came here, Marieko, there was this lady, never meets a gate from Marit.
I remember Marit, the old lady.
Yeah, the old lady.
Yeah.
So we went to Marit, she was nice. And then she was like, okay guys, you need to choose what
do you want to go work?
For those who didn't train motivation, we will help them orientation week. But for you guys, by the way, we are based more motivation during your training. I think you have an idea, so you can choose for what was Panaka. Not because now most of the time, Joe, I used to rotate 374, like 374. Even my first night shift was in 374.
So basically, that's your home. You know, 374 in and out.
I think that is how the transition from students to qualified RN, it was not that difficult.
When they told us to choose, I literally told them, put me anywhere. Because I did not know the hospital. I've never worked here, even as a student. We trained at Helen Joseph.
Oh, yeah, can you choose?
Yeah, you chose Helen Joseph. Now they are sending students here at Joburg Jet. But then it was Helen Joseph and Rahima Musa. And when we were placed to work at Joburg Jet, all right, we came for the orientation, I think on the 4th day of our orientation, which was 4 or 5, they asked us where we want to work as well, right? People put I think I was the only one that put, that said anywhere, and they placed me at 596. I remember there was this other guy, Ubanele, myself. He said to me, hey bro, I don't think you want to go there. I was like, what's wrong with that word? They first put me at 496, but it's a
Furlong.
No, 497, the infectious one, opposite Furlong. Right, I said, I can't go there. Me, I'm asthmatic, I'll die there. Put me anywhere but infectious. You understand? So, but okay, we'll put you at 596. Are you okay with that? And then when they ask me,
are you okay?
I'm like, as long as it's not infectious, put me anywhere. This guy came to me, are you sure you want to go there? I don't know what's happening. He trained here. He was last. He said, are you sure you want to go there? And I don't know the guy. Are you sure you want to go there? Bro, I don't know anything about this hospital, so everything will be new. I was the only ComServe that side. And unfortunately, I don't know wherever they placed him, it didn't work out well, and he was forced to move. They put him back with me in the 49596. I think we worked for like a few months, and then he went to theatre. Yeah, but from then, I never had that pre-knowledge of how this ward works and how this ward...
But you know, you know how they select? They select based on their previous experiences during training. There's casualty, As much as Ronamo Moshalat Makabe, it's trauma casualty, peace casualty, medical casualty, you know, we like
divided.
It's divided the disciplines. But some people will just say, as long as I'm in casualty. You understand? And someone would say, as long as I'm in theatre. Someone would say, as long as I'm in surgical. Regardless of whether it's orthopedic, whether it's vascular, whether it's gastro, as long as it's just surgical. I'm seeing wounds, I'm seeing cuts.
I'm good.
I'm taking patients to theatre, I understand.
Yeah.
And then someone would say medical. And then no medical, it keeps already the thyroid, you name them, what medical.
No.
I think that's how other people at the game came down to their decisions.
Now, you move from ortho, right? Ortho being your landing ward from ComServe. You move from there, you go to casualty, right? Let's look at casualty, taking casualty and ComServe. I mean, and postgrad, because ortho, I don't want to look at ortho because you were there, you were used to ortho, it was an environment that you were familiar with from your student years. Let's look at casualty as now a new environment in comparison to your fourth year or your undergrad. How was your adaptation there? How did you find ortho?
Casualty.
Yeah, casualty. Casualty.
Yes. So casualty for now, it was all about my lectures used to say practical. When they say practical, they usually mean whatever that we taught you in theory, it's time to practice it.
Bring it to life.
Bring it to life. Exactly. Casualty for now was, because go orthopedics, that was, Ricky, take it back a bit. Go orthopedics. What I learned more was management. Like, because when my OM was on leave, I'd do the call I'd know Ometro, sit down during the handover, it's at the weekend, and then we'd get taking information about better. There's so many beds, so many patients. Like our peripheral hospitals.
Yeah, so basically human management, human resource management.
Human resources, almost all types of fields, time management. That was orthopedics. I would do the way Mona would discuss the delegation, the off duties, you understand the whole concept of management. For now, that was
more in ortho, yes.
That was more in ortho. And then when I went to casualty, it was patient orientation. Or was patient orientated.
How was that adaptation there?
I found it was good. It was because I was happy to, like Jagaki, patient comes in. You need to remember, you need to bring back almost everything they taught you. Because BP is low. First thing you do, it's repeat that BP. If it's still low, you need to put up the line. Have to give fluids. To have to gain the volume expanders. You see such things. The compression on the patient is bleeding. Compression at the dressings, body. You interpret the gas. You interpret the X-rays. Like casualty, especially trauma casualty compared to medical casualty. I feel like go trauma casualty or mechanic. I used to say mechanic, like literally mechanic. You understand? Because we deal like
yeah,
literally or physiologically. Or understand? Win some more. High bleeder, we stop bleeder, we switch at
there and there.
People, casualty, it's busy, but it's not complicated. Unlike when you go to medical casualty. Medical casualty patient comes in, got BP, 250 over 190. BP airways elevated. Now you need to think, shit.
What do I do?
You repeat BP, you're thinking, or maybe it might go down.
Maybe I didn't put the cup.
Miraculously so. I understand.
Yeah.
Now you need to think calcium channel blockers. The AC inhibitors. So now that's when you develop renal. You need to interpret the bloods. When you pull bloods, they go to the lab, they come back. You need to interpret.
And act based on those results.
Based on the results. It's biochemistry.
Yeah.
Medical
casualty.
You need to remember your biology. You need to remember your chemistry.
Yeah.
The barometers. I need to.
How do I restore balance?
The kidneys. As much as rota too much calcium, the ions, the potassium. I need to replace the potassium. I need
That's in medical.
That's medical.
So for you, what makes trauma casualty special than the other casualties that we have? You don't like this. You want to be hands-on.
Yeah. Ronaldo will working.
Thinking, but hands-on.
That's what's special.
I saw another video of a guy that came with an okapi on the inside the eye. Like they just buried that okapi, whole knife, and they were knocking it with the hammer. When these people are working.
Hence I'm saying,
what's one thing that you've seen casualty and you're like,
that was horrifying.
Yeah, that was like, oh my word, what was happening there?
I wouldn't say it. I don't know, maybe people might say we are a bit heartless or desensitized to certain human or natural human responses.
Okay.
But it wasn't a disgusting or horrifying moment, but it was a sort of a bit touching. I know there was this. There were 5. Banabako Annex, they got banned. The parents are they divided the groove, they see Banabali Bacha, Basastina, above 60% bans, all of them. And all 3 times.
So they banned
5 of them.
They banned Mkukwini.
It was not a cuckoo or a shack, really a house that
informal,
But there was a moment I was like,
five kids.
We got 3 got trauma casualty, and then Pete's casualty took 2. They took 2, and now we got 3, and then all 3 of them. And it's the way they were crying, pain. Imagine one, and you can see, but now it's compared to the adults, like our trauma adult patients. They are drunk. She
said inside comes here.
And then you get one, maybe only one out like and then how or again. Good flu, but they were active, they will tell you, good flu.
And their whole face is bent, their whole body.
60% plus inhalation. There was a moment. But other than that, I've seen guts out.
And that was not disheartening for you. That was not distressing.
I've seen brain matter from a gunshot. I think more than 3 times we've had him gunshot, head.
I'm shining spamental.
Oozing heart again. Normally we say the patient is oozing blood.
Yeah.
Patient is oozing
brain.
Patient, I've seen that it wasn't disgusting. I've seen
the inside of a person. You've seen that.
Definitely. We've done a stenotomy. We opened a chest, right here, and then we've done a lot of thoracotomies. The thoracotomy is whereby maybe let's say you come most of the time we would do the thoracotomy your step heart. So before you take the patient to theater, you have to open up patient which is staying and then locate where the heart is bleeding exactly, and then you suture it. We do the hemostatic sutures. You suture that part of the heart so that it closes heart again, the bleeding, and then you transfuse emergency blood, and then the IC drain. When it bleeds out, there's these new IC drains. So those IC trains would pour in, I think, 1,000 units of heparin, the normal saline, so that when the blood goes into the
Doesn't clot.
it doesn't clot. You can actually give it back to the patient.
Oh.
So you do that, and then so that when you when you transfuse the patient, and then they clamp all the exit points. They'll only leave out the one that supplies the brain, because now the only thing they want to get blood
It's the brain.
So you fill up the heart.
So they prioritize basically the brain, yeah.
You fill up into it, because the brain cannot go for more than 3 minutes or 5 minutes without
oxygen, yeah.
So the other parts, they can survive. I think for the longest time, I don't know how long. So you just fill up the heart, and then we manually pump the heart.
While this person, you open this person at casualty.
And then you fill up the heart cup with blood, and then you manually pump it. And then you run to theater. The consultant will be there, or the reg will be there pumping the heart. You're no longer doing CPR.
Yeah, now it's you problem cardiac massage.
Exactly, 100% massage. Yeah, I've seen it. We've done a lot of thoracotomies. We've done, I think, bilateral thoracotomies. So this patient, they were not sure. They opened the left side, but then the patient was still bleeding a lot.
So they had to now locate the building on the other side.
It was a lady. I remember that lady was, I think it was a multiple gunshot. I told you to get your boyfriend. Yeah, she was a multiple gunshot. And then when they opened on the right side, they found that the bullet actually hit the nearly aortic duct or something. So they were like,
just let him go.
There was nothing.
Was there a time where someone came in and you saw, or maybe they are crying of pain, they are in pain, they are suffering, and the doctors were like, nah, we can't do anything here. Let's just wait for nature to take its course. Put him on supportive care while he's still on casualty.
You know what we did? It wasn't actually a matter of let that patient go, because I remember this one patient, Lena was a Benz patient. So what we did was just intubate the patient and give proper morphine. They would do the supportive care. So you remember going to school when they would tell you that to make sure that the patient
is pain-free.
Exactly. So that's what we did. Intubate the patient, because obviously, once you have a lot of morphine and domicam sedatives, more body you cannot have your respiratory relaxes.
Yeah.
So as long as you have intubated the patient, the machine is breathing for the patient, you can pump out as much domicam and morphine and let the patient go pain-free. That's
how do you sleep? Let's say how did you wait, let's start from how did you sleep after those 3 kids died?
And that's that is why I would say.
And to take into consideration that you are also a father.
Back then I was not a father yet, but then I had that thing. I could relate. It was a bit touching. You know why? I'm using the word bit, because that's where I don't know what I would say. It's a problem or what. Immediately when I knock off Joe, I completely forget.
You forget about 3 children that came in bent alive.
I would remember maybe when I get home and then someone would say, how was work? And then I was like, hey, sir, we had such and such, I think, resources or an experience. That's when I would remember. But and go to go casual to resource. I remember this lady, Otilenka, nearly taxi accident. She was broken everywhere, that lady. Broken, it's about broken.
Whole body.
The whole body, got a declaving wounds, and we did what we could. Ramurisasa. She died. Consulted every guys.
Time of death,
Let's call it off. And now we moved to the next patient. You forget, wrap up, done, we move. It's one of those things going back to Taba Ea, your knife. having time for yourself. It's also how we are generally more life. You're moving from one thing to the next. You're moving from one thing to the
Without
next.
processing.
Without processing, you never have time to reflect on what transpired during the day or during the previous again, whatever time. It's casualty for you. You only, it will be only a matter of management or what could have done differently with that patient. But then as you're thinking, you're moving on to the next. You understand?
Do you think nurses need counseling?
Well, actually, it's not normal. I've said this a lot of times. It's not normal. You know, back then, we would see a patient dying, we would lay the patient, move on, without it's not normal. But eventually, I started thinking about this last year.